Hey everyone, it's your stylist Lauren here, and I wanted to reach out and say, hey, see how y'all are doing, how you all are holding up, possibly do some mental health check-ins. I sent an email telling you guys if you had any questions, comments, or concerns as regards to your hair, uh, please feel free to call or text me, email me, whichever one works best for you. But I wanted to sit down and make a video and reach out to you personally just so we can talk and um, just share some information. And the first thing I wanted to share is the biggest question everybody basically has right now. And as you see, I have my phone because I want to have facts in my hands. I want to have viable information that I could actually point you to, and I'm not just making this up off the top of my head. So first of all, what is the COVID 19 disease? Coronaviruses, and this is according to the California Department of Health website. So what is COVID-19? Coronaviruses are a large group of viruses that are common among animals and humans. This novel coronavirus that causes COVID-19 is a newly discovered coronavirus that has not been previously detected in animals or humans. The source of this virus is not yet known. So, okay, aside from my opinions and my speculation, they're saying that they do not know what causes this disease. But as if we all know what's going on right now, and it's not cool. So let me give you some facts and some numbers as relates to California and the effect that it's having on us living here in California. So it says, as of March 23rd, 2020, 2 p.m. Pacific Daylight Time, there are a total of 2,102 positive cases and 40 deaths. Increase occurred over a period of 2 days. There have been 531 community-acquired cases, 1,571 cases acquired through person-to-person transmission, be that travel, including cruise ship passengers, or under investigation. This includes 31 healthcare workers. So the ages of the confirmed, positive cases are 0 to 17. There have been 28 cases. 18 to 49, there has been 970 cases. Ages 50 through 64, there has been 493 cases. And ages 65 and older, there have been 449 cases. And the unknown ages, there are 162. So let me pause for a cause real quick. We've all been under this notion that if we're in a particular age bracket, which is the 30s and 40s, we've all assumed that we were safe to some degree. Well, according to these numbers, ages 18 through 49, there have been 970 cases. That is far more than the 50 and up crowd. So 20s, 30s, and 40s, let's be safe, okay? Gender of all confirmed positive cases: females 843, males 1,081, and unknown 178. So clearly this disease don't like men. I don't know what the bias is, but it don't like men. And it says, in order to better focus public health resources on the changing needs of California communities, beginning on March 18th, the state is no longer collecting information about California travelers returning from countries that have confirmed COVID-19 outbreaks. Community transmission of COVID-19 has been identified in California since late February, and since early March, most of the confirmed cases in the state were not related to travel outside of the states. Next biggest question: what are the symptoms? The symptoms are fever, cough, and shortness of breath. If you think you have the symptoms, the first thing you should do is call your healthcare provider. Contacting them in advance will make sure that people can get the care they need without putting others at risk. Please be sure to tell your healthcare provider about your travel history. That's important. You can also take the following precautionary measures: avoid contact with sick individuals, wash hands often with soap and water for at least 20 seconds. Now, I don't think it's that hard for us to wash our hands. I understand, especially if you're in the field like myself, my hands are always in water. So if y'all could see what's been going on with my skin lately, it's bad. But let me tell you something. I would very much rather, have chapped hands and skin than sitting up here on my deathbed, coughing, sneezing, hacking, because I got corona, because I was too bougie to wash my hands. I'm not going to do that. And it's not that deep. So I'm going to continue to wash my hands. I'm going to continue to be a stickler about being clean. And I'm just going to be safe. So, what is the treatment for the coronavirus? That's another big question. It says from the website, from the international data we have, of those who have tested positive for COVID-19, approximately 80% do not exhibit symptoms that will require hospitalization. For patients who are more severely ill, hospitals can provide supportive care. Don't forget that word, supportive care. We are continuing to learn more about this novel coronavirus, and treatment may change over time. Now, I said hospitals can provide supportive care, meaning there is no cure. What they do, they support you medically. So if you're coughing and you got a fever, they could possibly help to drop your fever and aid you in your coughing, to kind of basically give you some cough suppressants, probably hydrate you up, get you a few IVs and call it a day. But in reality, it sounds as if there is no cure, and the best thing we can do is ride this wave. So if you're, as we all are, and I'm only saying if you are a resident of California, I'm only saying that because some people might be watching this video who are not. So if you are a California resident, we have been under this shelter in place order, meaning they don't want us to go outside unless it's for an essential activity, meaning you need to go grocery shopping, or you need to go to work, or you need to go see a healthcare provider. They have basically locked us in or told us, go home, you don't need nothing. Just go home and have a seat until this is all said and done. And so the practice that they have put upon us is called social distancing. So let me explain to you what this website tells us social distancing is. Social distancing is a practice recommended by public health officials to stop or slow down the spread of contagious diseases. It requires the creation of physical space between individuals who may spread certain infectious diseases. The key is to minimize the number of gatherings as much as possible and to achieve space between individuals when events or activities cannot be modified, postponed, or canceled. Achieving space between individuals of approximately 6 feet is advisable. Additionally, there is a particular focus on creating space between individuals who have come together in a one-time or rare basis, who have very different travel patterns, such as those coming from multiple countries, states, or countries. Why would you put countries, states, or countries? Whoever wrote this is on my nerves. Oh my goodness. Another great question, and I've had personal thoughts on this, but I'll read this. It says, should I wear a mask? The California Department of Public Health, along with the CDC, does not recommend that healthy people wear masks at this time. However, masks are recommended to limit the spread of disease for people who are exhibiting respiratory symptoms. Now, here's the thing. I don't have a problem with the average person wearing a mask. I really don't. I just hope that if you wear a mask, wear it properly. When you put it on your face, it should fit snug to your face. No air should be able to come in or out. It should be, well, obviously, air is going to come in, but it should sit flush against your skin. And second of all, those paper masks that you guys get, those are disposable, meaning you wear it once and throw it away. Same with your gloves. I think gloves are important, especially when going outside, when going to the gas station, when you're going to be in public stores, whatever the case may be. I think gloves are important. Gloves are also one-time uses. So when you go out, you handle your business, you go to the gas station, throw those gloves away. So now that we know what the coronavirus kind of is, because it's a respiratory disease. That's kind of all they gave us. So besides that, and understanding that we need to stay in the house, so we need to social distance, whether you have kids or whether you go to work or whether you work from home. The point is, they want us to stay home as much as possible. And I cannot stress enough just how important that is. Many people walking around here have the disease and do not know it. They do not know it because they do not know it because they're not exhibiting symptoms. And a lot of times people don't take certain precautions until they see or until they experience a symptom. Just like no one runs out and buys cough suppressant if they're not coughing, right? So, and a lot of times in situations like this, people think, oh, I'm good. I don't have no cough. I ain't got no fever. I'm good. The disease can lie dormant up to 2 weeks before you even get a symptom. So it's important. It's so important to stay home as much as possible. If you do not have to go outside, please don't. I myself have canceled the rest of my services for the rest of the month. That was a hard hit for me, but I have to do my part in making sure, but I have to do my part ensuring that I can do whatever I can to help flatten the curve. Meaning we need to get this rising slope of infectious disease under control. So if we can flatten that curve, that's what we're going to do. While social distancing, I want to address people who may be hypersensitive, who may have high anxiety, or who may struggle with depression. I'll be real, I have struggled with depression for the majority of my adult life. I have struggled with anxiety, and I'm hypersensitive. So I guess I'm just talking to myself. So let me address you. Let me address myself. It is important to check in with yourself. It's important to check in with yourself. And in checking in with yourself, there are 3 major things I like to really hit head on. And I learned this coping mechanism in counseling while dealing with depression. So the first thing is to acknowledge your feelings. I'm angry, I'm irritated, I'm finna flip. I'm all of that, right? Cool. It's okay. We have feelings for a reason. We have feelings to feel. And how you feel is real. And don't let anybody tell you otherwise. So the first thing is to acknowledge our feelings. The second thing is to point out why we are feeling that way. So I'm mad because I really want to go outside, but they're telling me I'm not supposed to. I'm irritated because I've been stuck in this house all day and I don't know what else to do. And I'm finna flip because nobody's answering the questions that we all need. Nobody. That's okay. Guess what? Those are all valid reasons. Those are all valid reasons. And guess what? And this is the third one. We all feel like that. You are not alone. It is important to understand that you are not walking through this alone. America is walking through this with you. Some people may walk around with a better grip on it than others. But at the end of the day, we're all confused. Everybody wants answers and we're not getting them. Our president isn't helping at all. Most of us do not trust him. And I said I wasn't going to get into that in this video, and I'm not. So let me fall back. We want answers. And unfortunately, we do not have them right now. The only thing they are telling us is to stay at home. And it's frustrating. It's irritating. I could see it causing anger. But that's okay. The best thing we can do once we've established those 3 things, once we've acknowledged our feelings, once we've figured out why we feel that way, and 3, now that we see that we're not by ourselves, there are certain things we can do to help alleviate that. 1, establish a routine. Wake up, drink some tea, read a book, exercise, do some yoga, binge watch some streaming, because it's a lot of shows on Netflix, Hulu, Vudu, Udo, all of them streaming channels that we need to catch up on. Let's talk about it. Getting a group book club with your friends. Start a book club with your friends. Take a walk your pets, play with your kids. FaceTime. We all got phones. Zoom, FaceTime. What's the other one for people who ain't got FaceTime? I don't even know. Android, whatever y'all version of FaceTime is, y'all can do that. Talk to somebody. And to me, the best thing from myself that I learned, being that I do suffer with depression, is to get out of this house. And when I say that, I don't mean go nowhere. I mean literally step outside the house. The sun, I don't know what it is. I'm not a medical professional, and I'm not going to sit up here and give you some medical professional reasoning for it. All I can say is there is something about the sun that, oof, felt God in that thing. But no, there's something about the sun, S-U-N, that has transformative properties in our body. It just makes you feel better. Have you ever just been in a dark room or in a dark place? You stepped outside and something just kind of lifted you. Not saying that it changed the situation, because it doesn't change the situation, but it lifts you a little bit. It makes you feel like, okay, get some fresh air. Sit outside. And if you are inside, do some house cleaning. This is spring. Now is the time. Start some projects. Get those honey-do lists under control. You know, finish the projects. Finish the crown molding in your house. Finish cleaning out your closet and your shoes. It's a lot that can be done around your home. And now we don't have the excuses anymore. So let's lean into those activities. And more importantly, reach out to somebody. Reach out to a family member. Reach out to your friends. Do some group FaceTimes with your friends. Have some fun. If you're on Instagram, follow D Nice. Follow him, because he have Instagram Live rocking with the parties. This is a shameless plug, not for me, but for D Nice. At D Nice, I'll put his Instagram handle in the bar below to let you guys know. But we're in this together. More importantly, we are all in this together. And I hope that the information I gave you, read off the phone and off the top of my head, I really hope this helps somebody. We are in this together, and I hope and pray that this reaches you in good spirits. And I hope it helped you. I hope it lifted you just a little bit. Just a little bit. Okay? So in the meantime, I'll be reaching out every now and then just to do some check-ins, see how you guys are doing. And if you want to, go ahead in the comments. Tell me, how you feeling? What's up? If you don't want to leave information like that in the comments, text me, call me, email me. Y'all got my number. If you're a client of mine, or we're friends, family, or whatever the case is, you have my number. Please feel free to reach out. Please feel free, because like I said before, and I'll say it 16 billion more times, you are not in this alone. We are in this together. And I hope and pray that you never feel alone again. If you ever did, if you ever felt alone, I hope and pray that you never feel alone again. I myself got you. If don't nobody else have you, I got you. All right. So I hope you guys have a great day. Peace out.